Uh, I've titled my presentation Engaging Community on Data a little differently because I suspect with the community of practice, a lot of people will be intensely familiar with some of the things I'm going to mention. But what I want to do is talk through some of our planning and thoughts about how we approach public engagement on data and AI. I'm an academic practitioner at the University of Liverpool, so some of this will be a little bit more from a theoretical level, and then we'll get into the practical at the end. For those who don't know us, and I assume most people do not, I come from a project called the Liverpool City Region Civic Data Cooperative. So we are funded by the Liverpool City Region Combined Authority and the Metro Mayor through an innovation grant to essentially use data to help improve service delivery and solve big problems. And that covers three main areas. First is exploring what we can do with data and research. So that's our technological arm. Second, imagining better services and solutions with data. That's our policy and problem arm. And third, engaging community on how they want to use data, which is obviously the most important arm because that is the one that I run. Uh, just an example of some of the projects that we've offered technological and public participation and deliberation exercises for. There's a range here. I think what you'll notice by some of these logos is a lot of them have something related to health in them. The meat of our work is really focused on health data and health AI development. So some of our research and projects are going to have a very strong health and well-being theme to them. Introductions aside, let's get into the meat of it a little bit. And I want to talk about the funny thing about having any kind of expertise on engaging different communities. I think we all are going to agree that this language of calling a community difficult or hard to reach is quite outdated. We tend to then switch it to something like hardly reached or uh, historically or systemically unengaged. But I genuinely believe, language aside, that it's kind of slapping a label on the same problem, which is systems and systematic biases. When we say that we need to have expertise on how to reach different communities, what we're really saying is we have a systems issue in how public participation works and who public participation and engagement involves. So there's two issues there. One is that, addressing a systems issue is actually very complicated. And so when we talk about these kinds of strategies, I don't think as public participation practitioners and academics, we're going to solve those in an easy 1, 2, 3 step. We have to think about that. I think the other thing is that what this says is that who we are as practitioners is different to who we're trying to engage, that there's a psychological separation between us and them. Who is this different community that we want to engage, we want to involve in these processes, and it's not us. And I think part of that is reflecting on our own bias. I know that's kind of rich. I'm a white woman from Canada coming on this call and talking about this issue. And the other half is saying that having true expertise in how to talk to and engage with your community comes from people who live in that community. And so I'm very happy to do this presentation second because what Henrietta said was excellent, and I'm going to try and build on that a little bit, which is doing co-creation and co-production is going to be the main theme from all of this and how you engage different communities. So back in 2010, a professor of psychology did a project that looked at who gets involved in psychological resource or research. I promise this will be relevant, but what they found is that 80% of study participants represented only 12% of the world's population, which is a massive systems gap in research. And I think this is pretty true across most of other research areas, but especially prevalent in psychology. And you can guess already, the people who were engaged are societies that are Western, read white, educated, industrialized, rich, and democratic. And I like to say that public engagement and participation historically has a whims problem, particularly when not done well. And for me, that means on the one hand, usually the people who get involved in exercises like this have the privilege and ability and the whim to take part. But more specifically, these are people who are white, they're healthy. A lot of the time, especially in academic public engagement, they're in retirement. They're middle class and they're skilled. And as you can imagine, if we talk about engaging different communities, and this is our default, we're going to have some issues in challenging some of the assumptions around data and AI. And as you all know, some of this is kind of part of the process. We have a public a population we want to engage with that we define through whatever we're doing. And by necessity, that has to include some filtering mechanisms on who gets engaged. The actual public we engage compared to the size of that population is obviously going to be magnitudes of different. But we have to think critically about what that arrow is doing and the processes that bias who gets involved. And why is that important? I think we all know this, but it's something from a healthcare perspective we're very passionate about, is that when we don't include communities outside of that WIMS framework, not only do our technologies not are not representative of them, it can do actual genuine harm to their health, their well-being, and their livelihoods. So let's talk about case studies. Let's move into the practical from some of that more theoretical conversation. So we finished a project up a year ago called Round Ear, which is about building community-led well-being data hubs in Widnes, UK. So this was specifically a peer research engagement methodology that asked, how do we make data work for a community by first asking them what kinds of things should we collect? So typically when you do a project around making some sort of shared data resource, you think, what is the data we have? And then you do your engagement resource saying, how could we use that? We wanted to take it a step further and say, what should we be collecting to begin with? A big part of this project was trying to think through what community we want decided in and how we reach them. So we wanted to set ourselves a bit of a challenge and choose a community that had historically been unengaged by the council. So we took about 8 months of interviews and research and desk-based research and conversations with different councillors, with charity leads, with representatives, voluntary sector leads from the communities, and said, where do you think we should cite this project that could have value, and a group that historically did not get engaged in these kinds of projects? We ended up in a much smaller community originally. I won't go over the issues there, but down the line through many different changes, we landed on Widnes, which is just south of the Liverpool city area, but it's part of the Liverpool city region sort of economic zone. So we thought about engaging in a community like this in two parts. One is the methodology of how we design the project itself. And second is, how do we get the people we want on board to begin with? So the methodology side, as I mentioned before, was peer research. I think this is an incredibly valuable method when you want to reach a community where you don't have established trust and relationships. So we employed 15 community researchers essentially to design the project with us and to go out and conduct the project themselves. So the second step to that about how we thought about getting these people involved was our community researcher recruitment itself. As I said, if you're going to a community where, people are not trusting of the government, they're not trusting of the council, they don't want to get involved in things. We had one council survey that went out while we were in recruitment, and I think in a community of like 200,000, it got 15 responses. This is a group of people who, did not trust the government and did not want to get involved. And we, although we're not government, we are funded by them. And so we represent that voice. We spent a lot of time essentially throwing things at the wall. Our best strategy was to listen to people on how we should engage this community and then to go out and try about 20 different things. We rented space in a shopping center. We had lots of staff on the ground just walking around community to understand and have chats with people. I myself did many, many drives, just going to meet with people in random coffee shops and have conversations. One of the best things we did was actually rent out an advertising spot at a Widnes Vikings game, which is a local rugby organization. I recognize that a lot of projects don't have the kind of money to do things like that, but we were lucky enough to have the cash to do that. It's actually a lot cheaper than you would think it is when you're talking about a very small scale sports team. Don't say anyone from Widnes on the call, don't say I said it was a small scale sports team. It's very important to them. But this was really effective, and we just walked up and down the stands, put posters up everywhere, and had conversations, and we got about 3 of our community researchers from that day. So that was a lot of time and money spent in trying to start that relationship build. We then designed the projects with them. We came with some ideas. I don't think you can start any of this, not coming with some kind of expertise on how to run a project like this, but we really took their voices on board and made sure that we designed it in a way that they could run. We even did some participatory voting and ranking in the design of the project, so it was really their decision on how we move forward. We've also been doing some broader work about how to engage with marginalized, minoritized groups. The least PC term would be sort of underprivileged communities. And how do we work with them to have community data conversations? So very informal opportunities to talk with them about data literacy and to understand the kinds of futures and directions they want from data and AI in the city region. These conversations, again, have looked at relationship and trust as the key issue in how we get involved with these communities. So instead of going out and hosting these with random focus groups, get people to sign up online, 10 people here, 10 people there, we've worked with community group leaders and paid them to take part in this with us. So every single group is involved both as like a category of people we're trying to engage, but also a specific community that already knows each other. And because there's that trusted relationship, it's a lot easier to negotiate trust with that group when we already have that community group leader on board. And also we pay people. I think that will be a common theme across all of this, is that we offer gift cards and we offer money for the time that they put into our projects. Finally, this is a exercise we're running right now, which is the Liverpool City Region Residents Assembly on Data and AI Innovation. And we've spent a lot of time thinking about the recruitment and the functioning of this event to be as broad and welcoming as possible. Obviously, we have specific recruitment criteria, but we've thought a lot about things like having the time of day and having caring responsibilities paid for those who are caregivers, ensuring there's live translation, creating space for people who might need quiet space, who have autism or ADHD, and just trying to communicate to people that we've really tried to think about what makes this space more accessible. Because no matter what, something like a residents' assembly, a citizens' jury is a really big ask of people. It's an incredible amount of time people have to commit to doing something, even though it's for them, quote unquote, it really is for us when we're asking them to come and comment on something. We're trying to create a better world. We're trying to do something positive, but ultimately we're still bringing them into a space that is our space, no matter what, and asking them to comment. So we've put a lot of effort into trying to think about how to make it more like their space. And I just want to end on something that has nothing to do with Liverpool at all, but some work I've done in my previous job where I was a knowledge exchange and public engagement lead in government. So during the pandemic, we did a lot of work on communicating health data, as you can imagine. And there was a lot of stress involved in how to set that group up. But the most sort of beneficial and the project I'm most proud of was the BC Indigenous Knowledge Translation Working Group. And I wanted to talk about it because it was put together with next to no money on a rapid turnaround of about 48 hours. We got a call to the health authority that said, there's a huge outbreak of COVID-19 in a community that has incredibly low literacy in rural Canada, has no access to information, has next to no digital access, and the vast majority of the elders who are getting infected with COVID-19 don't understand what it is and can't read. So how do we talk to that group about health data? That's hard. So what we ended up doing in 48 hours was coming up with some storyboarding ideas. And the only reason we were able to do this, and it was successful, and it went out to community and actually had a positive impact, was because the group of people who worked on it were already Indigenous. I am a white woman. You can see my face here, but I'm also Métis, Red River Métis, which is an Indigenous nation in Canada. Everyone else in that working group was either from a minority community or was from a First Nation across British Columbia. So having those people together who already had public engagement and health expertise, who were also from those communities, meant that we were sort of 5 steps ahead. And the other big thing about this project was having a sense of humility. As you can imagine, the scientists in the room really didn't want us to do drawings, really didn't want us to communicate with cartoon figures, and didn't necessarily want us talking about these, at that time, pregnancy and COVID-19 vaccination, incredibly uncertain issues to a community with any sense of certainty. So I just wanted to highlight that when we try to avoid that WIMS population in my past work, but also in Liverpool, the first thing and the most important thing is time and relationship negotiation. It's not seeing these, because we're working embedded in community in our project, we have the time to sit down and say, how do we actually have a relationship with these groups and not just a one-off engagement? Second, and what I wanted to highlight from that Indigenous example is humility. Recognize that I don't know it all. I might have expertise on deliberative methods, but I certainly don't have expertise on what it is like to live in one of these communities. Fair payment, the biggest one by far. The number of people we've gotten involved who've said to us, like, I pretty much came because you paid me. And I've had a lot of pushback from some external colleagues who have said, well, the kind of people who get involved who want to be paid aren't necessarily going to offer you, the perspective you need, which actually I've never found that to be true. Payment has never been a barrier to getting good quality engagement and positive outcomes from our processes. Again, this is a co-creation point, but it's really working with and not for. And lastly, throwing things at the wall. If you're working in a community you're trying to engage, you don't know how to engage, talk to them, have some humility about it, but then just try things. That Indigenous KT working group has won several awards now and is still running as a legacy of the project because it threw a bunch of stuff at the wall and several of those things stuck and made an incredibly positive impact. So there's a lot to be said for having a creative mindset to how to go about your processes. And I want to end on this point, which is that this is a quote from one of our round year interviews with our participants. And I think this is kind of the back end of saying this is a systemic issue. And if we're talking about marginalized communities, they're not marginalized because they've marginalized themselves. So there needs to be a certain level of guarantee that when you're engaging this community, that something is going to change, that you're not engaging them for, as what Henrietta said, a tokenistic reason. So what our participants said, their biggest concern was that nothing's going to change. That's my big concern. So collecting all this data, collecting all this information, and then it just festers on a shelf like a book in a library. If you went back to a person you engaged 12 months later, after you've identified what the support needs were, and you said, well, did anything happen? And they said, no, I don't want to speak to you. I'd be really, really annoyed. So ultimately, when you're talking about engaging with different communities, the biggest lesson here is it has to have impact. If you're talking to a group that's been systemically unengaged, to do that again is just burning the bridge down on your way over it.